All right, hello and good day. Welcome to Health Check on Voice of the People Television, the program where we have meaningful conversations about your health, your well-being, and how to live better every day. I am Praise Peters, and it is always a pleasure to have you join us on the show. Well, before we dive into today's conversation, remember that you can stay connected with us on all our social media platforms at VOP TV Live. And you can also watch us at VOP TV on SLTV channel 264. So wherever you're watching from today, whether at home or at work, or maybe when even catching us during a break, thank you for making Health Check a part of your day. Now, to the conversation for today, the global health community marked World Obesity Day, a campaign designed to draw attention to the growing challenge of obesity around the world. And while the day itself may have passed, the issues it raises are still very relevant because obesity is no longer just something we hear about in distant countries. It is increasingly becoming a reality in many communities, including here in Nigeria. Health experts has warned that obesity is rising globally, and projections suggest that by 2035, nearly half of the world's population could be living with overweight or obesity. But beyond the statistics, there are real people and there are real lifestyles. Many of us know someone struggling with weight, someone, trying different diets, exercise routines, detox drinks, and sometimes the results can still feel frustrating. You know what I'm talking about. And there are also many misconceptions about obesity, really. Some people believe that it is simply a matter of eating too much. Others believe it is purely about willpower. But the truth is far more complex. Our food environment, our work routines, our stress levels, sleep patterns, and even the way our cities are designed can influence our weight and overall health. And obesity is not just about appearance. It is closely related and linked to serious health conditions such as type 2 diabetes, hypertension, heart disease, and stroke. So today, we are having a very important and honest conversation about this. What it really is, what it is becoming, why it is more common, and what we can do to live healthier lives. And of course, I'm not doing this conversation alone. Joining me in the studio today are two respected health experts. First, we have Dr. Adedayo Adegite, an endocrinologist who specializes in hormone-related conditions, including obesity and metabolic disorders. Also joining me today is Dr. Charles Adeogun, a wellness physician and public health advocate with a strong focus on preventive health and lifestyle medicine. Thank you so very much, doctors, for joining this conversation today.
Thank you.
You're welcome, Dr. Charles.
Thank you.
How's your week been? How's the profession been? How's everything been?
It's been great. Thank you. How's yours been?
Fantastic. How have you been, Dr. Dayo? It's good to see you.
Awesome. Thank you.
Amazing. All right, so let's just delve into the conversation for today. So I'll start with Dr. Adedayo. Let me begin with you. When people hear the word obesity, many people simply think it means someone who has gained a whole lot of weight. I don't know how true that is, but I want you to speak from the medical standpoint, right? So medically speaking, what exactly qualifies as obesity?
Simply put, obesity is excess adipose tissue that is sufficient enough to impact an individual's health adversely. And so as against what we used to think, that obesity is about willpower, that those who are obese is because they are sloth, they're lazy,
they
don't have
eat
enough,
too much,
they don't eat
gluttons.
too much. It's much more than that. So now, recently, obesity has been classified as a disease, not just a lifestyle problem, it's a disease. And with focus now on how to treat the patients better, because if you think it's just a lifestyle problem or a cosmetic problem, then all of the things or changes that we are seeing now wouldn't have come to the fore. So obesity now is referred to as a chronic, that means lifelong, relapsing neuroendocrine and metabolic disease. So it's something that is lifelong, and it's also something that is relapsing. That's why you see that people lose weight, they gain it, they're struggling with the weight. So all of those elements are very, very important when you want to define obesity. So again, it's classified, different kind of classifications. There's one from the Edmonton Obesity Association where they classify into 5 categories. The category 0 for those who are just obese or overweight without any subclinical symptom or any problem. Then grade 1 or stage 1 is when individuals who are overweight or obese, but then they have some subclinical symptoms, or maybe they have impaired glucose tolerance. And then why stage 2 are those who already have established risk factors. Maybe they already develop hypertension, or they develop type 2 diabetes, or fatty liver, and all of that. Stage 3 is when there are also established complications. Maybe the individual now has heart problems, stroke, and heart failure. While stage 4 is severe, progression in this spectrum.
Wow, this is a whole lot. So we have the mindset, I'm speaking for the majority of Nigerians, that obesity is just a casual description. But from what you're saying, it's actually a medical condition.
Absolutely.
Well, sometimes in our society, when someone gains weight, people will say things like, oh, you are well fed. What are you eating? You look good. They say it like an evidence of good living, right? Meanwhile, our bodies might be screaming. So at what point should we differentiate between a normal weight gain and an obesity case? To know when it is a health concern or not.
At what point? So we usually use BMI. However,
body mass index.
Body mass index.
All right.
Which classify the normal BMI is between 19 and 24.9. So the way it's calculated is that you use your weight over height squared. That means the weight of the individual in kilogram over the height of the individual in square. But the problem with BMI is that if you have long bones, long bone contain a lot of, gives you a lot of weight. So you can have a falsely elevated value, which somebody who is not, who does not have obesity could be wrongly classified as having such. But there are also those who may have apparently normal BMI who are actually have obese, because obesity, remember, is about visceral fat. It's against just subcutaneous fat. So there are people who are fat inside, but they are thin outwardly. Do you understand? There's a concept like that, where they are fat inside, but they are thin. When you look at them, they don't look fat, but inside there's huge fat parts around their liver. Yeah, absolutely. Around the organs in the body, there's a huge parts of fats, and it is these huge parts of fat that contributes or actually causes what we call insulin resistance, or almost all the problems that are attributed to obesity are caused by these fats. So we use more of, now we focus more on the waist circumference, because that predicts whether you're going to develop all this problem or not, as against the BMI. So the waist circumference that is used, unfortunately in Africa, because we don't have consensus about what values should be used. There have been different studies saying different things. But for the Europeans, they have a number. So any waist circumference above 94 in men, that's 94 centimeter, predicts development of insulin resistance. And of course, that makes you at the risk of all of these complications. Then any value above 80 centimeter in women also, we would say, okay. But if you want to use the BMI strictly, once your BMI is above 25 and above, up to about 30, you are overweight. Then from 25 to 29.9, that means you are overweight. Then from 30 and above, you are obese. Now that obesity now has classification. There is stage 1, which is from 30 to 34.9, then from 35 to 39.9, that's stage 3. Then anything above 40 and above, they will say the individual has stage 3, or what we call morbid obesity.
Wow.
But again, like I said, BMI is no more a very sensitive instrument for predicting all of these problems. So we focus more on the waist circumference. It's a tool, and then of course this is evolving beyond your waist circumference. Now there are certain instruments now that you can use to determine the amount of fats that is inside our body. You know, there are different instruments, radiological instruments now that are used to actually quantify the amount of fats. So if you also have access to all of these tools, they can be also very useful in predicting whether you're going to develop problem or not. Because remember, it's not just about the fact that the individual is overweight or obese. It is, remember the definition. Definition of obesity is excess adipose tissue that is sufficient enough to adversely affect your health. So if it's not affecting your health adversely, maybe it's not a problem enough.
Wow. Okay, I can see how much you are specialized in this. Okay, let me go over to Dr. Charles. So, Dr. Charles, when someone develops obesity, what actually happens inside the body, and why is it that, when someone has obesity, they tend to, have other related conditions like hypertension, all of that. So, why does obesity as a whole affect the entirety of the body? What really happens?
Just like the doctor has explained, obesity is a disease condition, and it affects the organs, and in fact it has a systemic consequence overall. The visceral fat that doctor has talked about is fat infiltrating into vital body organs and affecting the functions of this organ. We have something called fatty liver, which is attributed to alcohol in some people, chronic alcohol use, or sometimes people with high body mass index, or people who are obese on the big side. Typically, obesity has been linked or has been associated with a lot of medical conditions that are very important that we highlight. First is hypertension, because people that are obese, most likely factors that are responsible for that, genetics, their lifestyle, the kind of diet, high calorie diet, high fat diet and all that. Some of the saturated fats that a lot of people consume, some of them are very unhealthy. They lead to clogging up of arteries. They lead to circulatory problems. Excuse me.
Sorry.
Circulatory problems, peripheral vascular disease, increases the risk of strokes, increases the risk of blood clot formation. Because a lot of people who are actually obese, they also have mobility problems.
Yeah, they don't seem to know how to carry themselves.
Even aside that, like the knees are the weight-bearing parts of the body, they have a strong association with arthritis because of inflammation going on there, and that affects their mobility. And when you are sedentary, the likelihood of you forming blood clots increases, and that increases your chances of cardiovascular events, thromboembolic events, what we call deep vein thrombosis, leading to pulmonary embolism. All these are potentially fatal conditions. Wow. So that is why anybody who is obese has a constellation of illnesses that can, show up in them. And there's also a very strong association of cancers with obesity. There are some cancers that obesity ranks very high as one of the risk factors that are associated with such cancers, like endometrial cancer, like even breast cancer, colorectal cancer. They are all linked to people who are on the big side, who are really very obese. So it's very important that we know that it can affect virtually every part of the body, the circulatory system, cardiovascular system, even sleep apnea. A lot of people, because they are obese, some research has shown now that if you have neck circumference of greater than 17 cm, you're at an increased risk of sleep apnea, obstructive sleep apnea. And sleep apnea is that condition whereby when a person is asleep, he has periods of cessation of breathing due to obstruction of the airway. And of course, a lot of people who are overweight or obese, they snore a lot, and that is because of airway obstruction. Wow. They have a lot of fat around their neck area, compressing on the airway and causing obstruction. And it is not just the obstruction, reduced oxygenation, leading to increased risk of cardiac failure and even hypertension. So all these things are, you can see that they are all interlinked, and you find out that anybody who is obese is having multiple illnesses, comorbidities, things that, that greatly affects their health adversely. And at the end of the day, by the time you are dealing with this and that and this, you have so many drugs to take, you have so many treatments to go through, and it may even be more difficult to manage compliance, because it's not very easy to take medication. Exactly. So you can imagine you having to take multiple medications because of multiple conditions that you're dealing with simultaneously.
Yeah.
So all those eventually would lead to complicated cases. So that's why most times, regardless of whatever condition a person is managing, if the person has obesity can complicate virtually anything. So even when they go for a surgery, the rate of healing or recovery can be affected. The skin, they can have flabby skin, loss of collagen, wrinkles, early wrinkling, and cellulites, and all these things, stretch marks, striae, and all that. All those things go a long way to affect the quality of the skin and healing processing of the skin. So at the end of the day, you find out that people that are obese, they have a lot to deal with. So most of the time when we say an obese person, the counseling that comes is, first and foremost, you need to do something about it. Know that it is affecting your health adversely, as the doctor has said. Secondly, you need to start active exercising. Then you face your diets, because it's all about your input also. You can't do anything about your genetics, but the ones you can do something about, you try to enforce that and do as much as you can. Portion control, being intentional about your diet, cutting out processed food, reducing high calorie food, reducing high sugar content foods, cutting out of alcohol, reducing sedentary lifestyle. All this to a large extent would help significantly manage the health of the person. So it's the work of the endocrinologist and the nutritionist or dietitian to give the proper path,
Follow-up.
To making sure that the weight is properly managed and the person, gets to the target weight, because it won't happen overnight. Nobody would weigh so much and then drop overnight. So, and discipline and consistency on the part of the patient is very essential. You can't do it for just 1 week and then for the next 3 weeks you are doing anything you want to do. So if you really want the outcome you want, you really have to be disciplined and be consistent with what you have to do.
But one funny thing, doctors, is that when people start to intentionally lose weight, you hear people talking, are you okay? Are you sick? Do you have a condition? And people start to, label you trying to come to a lesser weight as sickness itself. And we need to really trace that misconception.
Yeah, that's a misconception, because most of the time a lot of people perceive you and they have different impressions about you at different times. But what should count is...
They start giving unsolicited comments.
But that is why...
we prefer you the other way.
But that is why...
it now influence the person's decision.
I think that is why it's important that you don't take advice from people that are not medical professionals. Exactly. Because this is your health. So people's perception of you or whatever they feel about how you look or how about whatever your physique looks like does not really count. So far your health practitioner has given you a clean bill of health that you're doing well, or knows your story, knows where you're coming from, and knows where you are currently on your journey, and is sure that that is the path you need to toe. You don't need any explanation to give to anybody. So it's just for your own well-being and for your ultimate good.
Right. All right, Dr. Adedayo, let's talk about modern lifestyle. You talked about that earlier. Many people today live extremely busy lives. We wake up early, rush to work, sit behind the desk for hours, sedentary lifestyle, like you said, deal with traffic, get home tired. The earliest option is fast food. Like the easiest option is fast food, and we both know that fast food is not as healthy as we take it. So how much has this modern lifestyle contributed to the rising obesity problem?
Huge. Contributed a lot. So obesity, irritability, that means the risk of developing obesity, the genetic contributes only about 40 to 70%. The rest is as a result of epigenetics, which is how these genes are modulated by environmental factors. And one of the major environmental factors is our lifestyle. Like you've mentioned, the kind of food we eat, trans fat food, high-laden calorie food, and of course, the lifestyle, we sit behind the desk for hours, sedentary lifestyle, we don't have enough time to rest. We take calls.
We rarely even take
The other time
walks.
we talked about the fact that when you don't sleep enough, I mean, sleep deprivation is a major cause of, so we call all these things obesogenes. Obesogenes, that's what we call them. All these things, because they modulate your gene towards accumulation of adipose tissue. So you don't sleep well, you spend just 3, 4, 5 hours to rest in the night, or at the time you're even resting is outside your circadian rhythm. You know, our body has a time clock. And if you don't sink into that time, we run the tendency of having these problems that we're talking about. So the risk of developing excess fats is higher when we are outside our circadian rhythm. So that means when you're sleeping by 1 a.m., that's not the time your body clock is set for you to sleep.
Yeah.
Yes.
Wow. But you're not talking about, you know, taking walks, random walks. How important is that in managing obesity?
Very, very important. So,
but working in Lagos, taking random walks in Lagos seems like you're wasting your time. Seems like a big project.
No, you can walk within your household. So I always ask my patients, where do you live? That's the first question. If they live in a place with high traffic, or maybe there's likelihood of security threats to their lives, I tell them, okay, just walk. You can even walk within your room. You can walk maybe up the stairs and down. So walk is walk. How you do it doesn't really matter. If you cannot afford to buy like equipment like treadmill in your house, you can make do with cheap options. And the cheapest way to exercise is walk.
Yeah.
You don't pay for anything to walk. Yes.
You don't have to go to the gym to walk.
No, you don't have to.
All right. So, doctor, still about food habits and all of that. You know, sugary foods and all of that are kind of most convenient to us. It is most convenient, and culturally, in many homes, refusing extra food can feel like an insult. So if you say, do you want more? Yes, I need more, and all of that. And before you know, you find yourself eating more than you should. So how do we even manage this, really?
Well, I think it has to do with, people's, the tendency to overeat, the kind of appetite, the family structure. Like you said, a child who is refusing to eat, some parents may not like that. And they tell you, do you want to waste my food? I spent a lot of money. I spent so much time preparing this meal. But we should try to understand that overeating is really detrimental to our health, because malnutrition is actually divided into undernutrition and overnutrition. So you can actually be overnourished. A lot of people, when we hear malnutrition, we just think of people who have kwashiorkor, people who are so slim and lean, emaciated and all that. But the truth is, malnutrition also refers to people who are overnourished, of which obesity falls in that group as well. It's also very necessary that we know that our habits and the people we look up to and our so-called models too can influence our decisions on our lifestyle and our diet. Because you find out that a lot of people who are athletic or into the sports also play around with steroids for performance. And this can also bring about obesity, because you being on steroids also makes you blow up and you can become overweight. And people that take contraceptives too, there are certain forms of contraception that would also increase your weight, that you would just observe that you're adding weight significantly, by virtue of the contraception you're on. And a lot of people that are also dealing with certain conditions like depression, certain antidepressants have also been linked to obesity.
Really?
Yeah, so you notice that the more you're taking it, you're just adding weight, and you can't explain where
And people will be like,
where
oh,
that is
you
coming
look so
from.
good.
Yeah, and people will be like, yeah, you must
You
be
keep
you must
doing
be so relaxed, or maybe
Peace of
you're not
mind.
experiencing exactly you're not experiencing any form of stress or pressure and everything, but a lot of things may be going wrong. So we need to really know the kind of things that we introduce into our body, and then we really need to be aware of the choices that we make and the people that young people make their role models. Because a lot of people, when they see somebody that they like, maybe a star or a well-known person, you just want to try to look like them, you want to have their kind of muscles, you want to just, you know, just toe that path. And at the end of the day, you know that before you can achieve that, you probably need to do some metabolic alteration. There's something that you have to put into your body that would give you that effect, and some of these things may be actually adverse, you know, as a consequence. So it's very important that young people are properly guided, and a lot of older people too, they make sure that you don't need to force your kids to eat huge chunks of food when they tell you that they are okay. When they tell you that they are okay, believe them. If they need to eat more later, they would ask for more.
Exactly.
And you give them, rather than you just overfeeding, overstretching
and some people are
things.
always like, oh, now that we saw an extra meal, why not take it? There are some days that will not.
But I'm sure you've also noticed on social media sometimes when they show some videos where you find out that somebody is putting up snacks or having a school pack, making up a school pack for a child, and you wonder all the kind of things that they would put up for the little boy who is just going to be away for how many hours, and you're putting all that, and you expect him to eat all that and still be concentrating in school and be functional in school, and he comes back home to a bigger meal.
More.
Yeah, so you know, sometimes some of the parenting styles too play a huge role in all this. Yeah, so we should do better, because if we really want the best for these kids, we should start you know, mentoring them properly and giving them the right advice, you know, right from their young ages.
The right portions.
Yeah.
Yeah. All right, Dr. Dayo, you talked about earlier how that obesity is linked to some other diseases, right? Many other chronic diseases. So can you please explain the link between obesity and conditions like type 2 diabetes and hypertension?
Oh, thank you. Obesity is by far the greatest association with diabetes, or the greatest risk factor for type 2 diabetes.
Wow.
And those who are obese, of course, remember that the problem is with the visceral fat. So this visceral fat produces some toxic chemicals. And these toxic chemicals are poisonous to receptors, to insulin receptors. So they make it difficult for insulin to act at its receptor. Basically, that's what we call insulin resistance. So because there's a resistance at the molecular level, so insulin is not acting. So what the body does now is to compensate by producing more insulin from the pancreas. So you find more and more insulin being produced in order to overcome the resistance. So people who are obese have what we call insulin resistance, and when you check the insulin level in their body, they have supra-physiological level of insulin. That means the level of insulin in their body is higher than a normal person. Do you understand?
Yeah.
So as a matter of fact, that's one way to know whether somebody has insulin resistance. You can check actually the insulin level and see whether the level is higher than normal. So, and what happens is that because the insulin is not acting, it's as good as if insulin is not available. Do you understand? It's like you have money, but you can't use it. So it's as good as it's not available. Do you remember when the federal government said that the old notes, when there was a change in the old notes,
yes.
Whatever, even if you have billions of naira kept somewhere,
it's useless.
As long as it's the old notes, you can't use it.
Yes,
exactly.
Yes. So maybe you just picture it in your mind that exactly what is happening here.
Wow.
And because of that, you remember the insulin's function is to ensure that glucose enter into the tissue. So then their blood sugar level goes up and they have all the symptoms of type 2 diabetes. Now, for the same reason, because insulin level is high, insulin itself can contribute also to even excess fat. So it's like a vicious cycle. And it also encourages salt and water retention in the body. And because salt and water is retained in the body, they are likely to develop hypertension. So as many as about 2/3 of people who have type 2 diabetes also will have hypertension. So there's a very close link between these two. Of course, there are so many other factors. There are so many, we call them pro-inflammatory markers that are released when people have insulin resistance. All of these also makes the arterioles, those are tiny vessels at the distant level, to get tinier, and and because of that, these people will develop also hypertension. And of course, when you have type 2 diabetes, insulin resistant, hypertension, you can predict all the other sequelae of obesity.
Wow.
So basically, yeah, that very strong link between these two conditions.
Now, I'm very curious. Does obesity affect the mental well-being of the person? Like, are there psychological factors or social factors associated with obesity?
Yeah, people who are obese tend to have poor self-esteem.
Thank you.
Yeah, they tend to have, I mean, that's why the narrative is changing now. In those days, we used to blame people and say, hey, poor you're lazy, you're eating too much. I know so many people who are obese who don't eat a lot. Do you understand?
Yeah.
Because again, if we, the other time we were talking about the epigenetics, how even people developing obesity are programmed through the intrauterine life when their mother conceived them. Mothers who are obese, mothers who have gestational diabetes, or a child who has stressful condition during pregnancy. For example, who has what we call intrauterine growth retardation, or if there are any adverse problem during pregnancy, they are more likely to be obese later in life. Wow. So any stressful condition that a baby goes through during pregnancy make them to be at the risk of developing obesity even in later life. Of course, because all these factors modulate the gene that contribute to developing obesity in one way or the other. So if somebody goes through all of that during intrauterine life, how do you blame them for being obese later in life? Do you understand what I'm saying? Also, what happens to you during your early life? So I think the other time I mentioned what we call the thrifty gene, if you remember.
Yeah.
So let me give you the typical thrifty gene hypothesis. Somebody was brought up in, with due respect to people in Ajegunle or somewhere, or maybe one area.
Okay.
So maybe, or somebody was brought up in a very poor resource environment. Let me put it that way. Okay. So with due respect to people who were brought up in poor,
no.
most of us were brought up in poor resource areas.
Yeah.
And then with very little calorie intake. Maybe the child eats only 100. And then the child now grew out of life. So the body has learned to depend on little to survive.
Yes.
So this child now, had a great break, got a very good job, and now began to eat more than, or even eat what is now normal. What the body does is because the body is used to conserving energy. So the body retains, let's say the child is eating, let's say 10 calories, and let's say that 10 calories ordinarily should have been enough for the body. But the body will store maybe like 8 out of that 10 in form of fat for this individual. Because this body over the years has learned to depend on
little.
2. Now she is taking 10. Even though 10 will be normal for somebody else, but for him, 10 is too much.
Because that's what your body has adapted to.
Yeah, so we call it thrifty gene hypothesis. So the epigenetics that I was talking about, how these things shape how people develop obesity. So you can't blame that kind of person for eating too much. Because he's actually eating normal food. But he realizes that I'm eating little, I'm not even eating as much as dog, but why am I getting too much weight? So this is a major problem.
It's actually a major problem because, I don't know, okay, you're more into public health, right? But I want us to have a conversation now. I am online and I see some people dance with their big bodies, and then you go to the comment section and the person would have so many backlashes like, oh, you are so big, you are so fat, you can't even move your body well. And there is a stigma that is attached to these assumptions that, oh, you eat too much, you do this. So I really think that people should understand that it's not about food. It's not just about having so much to eat and all that. It is more than that, really. So we should do better in understanding this. So, all right, doctor, I want us to talk about the myths around weight loss. right? The internet is full of advice. You know, detox drinks, miracle diets, you know, quick fixes. So I really want to know from your point of view, do they really work? All of these.
Well, for me, when questions like this arise, the answer remains the same.
Yeah.
Your health professionals are the best people to go to get quality advice, quality guidance, so you don't run into problems. Because you don't want to use your money to buy what will kill you. You don't want to use your money to buy what will complicate cases for you. Because basically, we all know that if you want to lose weight, your weight loss program has to do with your diet, has to do with your exercises, has to do with lifestyle modifications. If you would need any form of medications or treatment, then it is the health professional that should work, you know, to give you that prescription. So it's the health professional who has different methods, different medications, different classes of drugs that they can introduce you to, or you know, or a diet plan, a proper diet plan that is scientifically or evidence-based, that we know that, okay, when we place you on this kind of diet, you're probably going to lose significant weight, or we'll make sure that we space out your diets, you know, the portions and all that, and the number of calories you should get per meal. That can only be done by a professional. But if you go for quick fixes that promises you 20 kg loss in 1 week, it's not going to be feasible.
I actually want you to talk about the practical steps, the little baby steps that we can take towards achieving this, the management of obesity and all that, because it could be overwhelming for some people. Like, where do I start and all of that? So what practical steps, what should they start doing to enable this?
So the first thing you need to start doing is, you know, it has to do with your inputs. So what are you putting into your body? Your diet is a key aspect. So you need to monitor your portion control. You need to monitor the calories that you feed on, the sugar contents of your diet. Also, your exercises. You need to stay active. You can't be sedentary and you say you want to lose weight. So you need to move. You need to move, you need to stay active. Every 2 or 3 hours, you need to move around. Use the staircase, use the, you know, take your walks on the roads in a safe environment, that is. And then you try as much as possible to cut off the sodas. If you drink alcohol, you may need to stop drinking alcohol, because all those also increase your chances of truncal obesity. And then for a lot of people that also use skincare products that are very high in steroids, introducing steroids into your body in whatever form, you know, can also still increase your chances of obesity and having stretch marks and the rest of them. Then it's also important that you monitor your sleep-wake cycle. Doctor was talking about circadian rhythm. Your sleep also is important. You go to bed at the right time and you get the normal hours of sleep that is expected of you. Your body needs to get properly rested, so that you don't have high cortisol levels.
Which is about 8 hours.
I don't want to fix a particular number of hours for people, because
I don't want to say it's unrealistic.
But that is ideal. That is ideal. In a normal setting, if everything works according to plan, if everything is normal, yes, 8 hours of sleep will be ideal. All things being equal. But they are never equal. Most times they are not equal. So why get the number of hours of rest that will keep your body refreshed. At least when you wake up, you should feel refreshed. You should know that this was a rest period, and you know your energy levels feel refreshed, clarity of mind.
And sleep truly, not like you are sleeping and your head is still processing a lot.
And you know that happens a lot in Lagos. A lot of people just shut their eyes and their minds are everywhere.
Exactly.
So it's very important that.
Exactly. My God.
A lot of things to meet up with, especially when the month is running to an end, or maybe a quarter is running to an end. There's so much pressure. You have a lot of obligations and all that.
And all that.
So it's important that you keep all that in check, and then you make sure that you know you go for your regular visits, and you have a scale, because you don't want your mirror to tell you. Am I losing weight or not?
You have lots of assumptions.
Exactly. Wrong assumptions mostly. So you have a scale, monitor the trend of your weight, and notice how well you're doing, and observe how much of the kilos you are shedding off. Because when you keep a record, that is how you can actually track your progress.
Yeah. All right. On a final note, Dr. Dayo, we would like to wrap up. So if you would share one key message that you would like viewers to remember about obesity and healthy living, the communities, the governments, everybody? What would you want us to know about it?
Well, that obesity now is a disease, and that it's not your fault that you're obese. Yeah, of course, you have some responsibilities, but then, I mean, we now know that it's not just about you, but there's a lot you can do about it, and there's a lot we need to learn and know about obesity. And one thing that we didn't talk about is what we call the endocrine disruptors. There are a lot of chemicals that we consume every day that mimic or block the signaling hormones in our body. Some of them are in plastics, cans of the food that we eat, like BPA, one of the chemicals. The other one is also phthalates. There are quite a number of chemicals that actually disrupt our hormones and make us to gain excess weight. So we need to begin to talk to the government to control some of these things. We need to find alternatives because they actually play significant role in the emergence of obesity we are seeing in our time. So beyond the days where you say it's about food that you eat, we know quite a number of things that are the undercurrents of the obesity in our time.
All right. Well, thank you so much. This has been a very insightful conversation. From all we've talked about, really, we can understand that obesity is clearly a complex health issue influenced by lifestyle, environments, culture, your health systems, and all of that. But as we've heard today, making healthier choices and creating supportive environments can go a long way in improving our well-being. I want to sincerely appreciate Dr. Dayo and Dr. Charles for being a part of this conversation.
Thank you for having us.
Thank you so much, and for sharing your expertise, really. And to our viewers, thank you so very much for watching Health Check today. I am Praise Peters. Remember to follow us across VOP TV on all our social media platforms, and you can also watch us on SLTV channel 264. Until next time, please stay informed, stay active, and take very good care of your health. Bye for now.